everyone, it's June 26, 2023. I hope you all are doing well. I'm wishing that I was somewhere very, very warm on a beach. Henceforth, the background. So recently, I posted an announcement that I earned a new certification. And that certification was a micro credential for outpatient clinical documentation improvement. So everybody was saying thank you. And some people either inboxed me or posted on my post asking, how did I get into clinical documentation improvement, specifically outpatient? Well, let me share with you my journey and how I believe I organically got into clinical documentation improvement. I started in healthcare in 1992 as a medical assistant when we had paper everything, paper medical records, paper claim forms that I typed up on the typewriter. And so, as a part of my role as a medical assistant, I was assisting the provider's office. I was assisting in, believe it or not, the emergency department. I worked on a hospital floor. I worked in specialty clinics, so an orthopedic center that was attached to the emergency room at Mercy Hospital. I also worked for OBGYN. I worked for gastroenterology. I worked for cardiology. I worked for internal medicine, quite naturally. And in working in all of those specialties, if they did procedures in the office, so OBGYN, colposcopies and wet mounts and any of the things that they did, I was the person who set up the room. Oh, I worked for a general surgeon. So I would set up the room, right? I would set up the surgical tray. And part of my job, honestly, that I personally just took on was making sure that everything we did was documented in the medical record. I mean, I gave injections, I did EKGs. I mean, all the things that I did, and I think back on it today, wow, that really gave me a solid foundation. Now, in case you're wondering, I went to school for medical assisting. In fact, I had to go twice because one of the schools that I went to was not accredited and it closed. But in that training, I have college credit in medical terminology, anatomy and physiology, pharmacology, disease process, right? So all the things that help support the work that I was doing. And as I continued in this capacity, I was forced into coding. I was forced into billing, typing up the claim forms, calling the insurance company, insurance verification, very manual at that process. And I was also responsible for gathering the medical records to prepare for clinic. So back in those days, 2 days before clinic, I would first have to find the medical records. Sometimes they were in the back of a car in the trunk because the doctor took them home because they were going to document. And so when I got the medical records, I always looked through them to see what the patient had ordered prior to that visit. So was there any labs I needed to make sure that we had? I would call the patient 2 days before their appointment, remind them about their appointment, remind them to bring their medications or bring a list, right? And so then as I was either pulling medical records for the visit or putting the medical records back up, I just naturally always made sure that the notes were documented, right? Now, back then, I don't know if I was necessarily looking to improve the documentation, but most certainly I was just looking to make sure that the visit was documented. And it was a physician who actually kind of forced me into coding. And he said, okay, we got this encounter form. And I wanted you to make sure that everything I did, everything you did gets on here, right? So if I did an EKG, if I gave an injection, if I did, stool samples, back then, I was drawing the blood in the office. When I worked on the hospital floor, I was starting IVs, still collecting blood, doing EKGs. In fact, when I worked at the University of Chicago as a patient care technician, we had to basically read EKGs. And I will never forget, I come from a family of nurses, I come from a family of strong women. And in order to pass this training, and I still have my paperwork, in order to pass this training, you had to read EKGs. And the person who was like over the thing, she was like, I know you're a medical assistant, but this is different because you got to read the EKG. Well, first of all, don't ever challenge me because I'm going to fight to the death. So my aunt, Lynette, who is a nurse, I went to her house and had a boot camp. We had these things called calipers, right? And so I was reading the EKG strip, Mobitz type 2, right? Ventricular tachycardia. And it was so weird about how all of that comes full circle. I'm not a nurse, right? I'm not a physician, but I had enough information to have an intelligent conversation with the clinician about their documentation, not challenging, quite naturally, the documentation, but I partnered with them to make sure that what they said they did, they did. And then, I could put the medical record back up. But then I found myself doing coding audits, like retrospective coding audits. And I would look at what was reimbursed, what was documented to see if it aligned, right? And so I did that for physician practices, outpatient hospital, inpatient hospital, and I just continued to grow and grow and grow. But also, as a part of that process, I did provider education. And because my knowledge continued to get stronger and stronger and stronger, I was able to say to the provider, in your medical record, I see you gave the patient some antibiotics today, but you didn't tell us why the patient need the antibiotics. I see in the medical record, right, that you renewed the prescription for XYZ medication, but you didn't put the diagnoses in the medical record. And not challenging the provider, partnering. On the first page of the guidelines, what does it say? In order to achieve accurate and complete documentation, it is essential that the coder and the physician collaborate. And so, while I don't necessarily like production coding, I like partnering with physicians. I like educating them on their documentation and really just supporting them in the work that they do. And when I meet with them, I'm not trying to make them a coder. I'm just trying to ensure that we're all protected from a documentation perspective. So now here we are 31 years later, and I still enjoy that. But I also enjoy educating coders. I think that there's this perception that coding is easy, right? And you can learn it so quickly. And 31 years later, I'm still learning. I'm still growing. I have this hunger, if you will, for knowledge because I want to just continue to be a part of the healthcare ecosystem. I got, degrees in healthcare administration, and I love doing things like interim management where maybe the manager is off for 3 months and they need somebody to come in and roll up their sleeves. I'm an authentic leader. I'm a transparent leader. But most importantly, I started from the bottom and now I'm here. But I can work with teams to build teams, together. And that's a direct result of me knowing where I've been, knowing where I'm headed, but also growing and growing and growing. So, to those of you who asked that question, thank you so much for the question. If you have additional questions, please drop them in the chat and I'm happy to respond.